Hello everyone, this is Indian Doctor, and in this video we are going to learn about urine-based pregnancy test. In this video we are going to cover the procedure, interpretation of the result, and how the pregnancy test kit works. Let's begin. Urine-based pregnancy test. First of all, we need to learn about pregnancy test. And kit. The urine-based pregnancy test is easy to perform and inexpensive compared to blood test. And in market, the urine-based pregnancy test kits are available without any prescription. Now let's learn little in detail about the pregnancy test kit. In the pregnancy test kit, the dropper is to place the urine sample and the plastic strip is known as the test card, and there is the circular and a rectangular window on the test card. There is the letter S, T and C written over the test card, whereas the circular window is also known as S basin, whereas S stands for the sample, T stands for the test, and the C stands for the control. Let's move on to topic how the pregnancy test kit works. The pregnancy test kit detects HCG, whereas HCG stands for human chorionic gonadotropin. Human chorionic gonadotropin is made up of two subunits. These subunits are alpha and beta, known as alpha HCG and beta HCG, out of which beta HCG is more specific. And HCG is detectable in urine 10 days after conception, or in the rough words, we can say that after the 14 days of intercourse. Now let's talk about the procedure. You supposed to place 3 drops of urine in the S basin. It would be nice if you take midstream morning urine sample. A salt line appear at C area. After a minute, if another line appear at T area, then the patient is pregnant. You can say the pregnancy test is positive and other line is not appear at T area, then the patient is not pregnant. Or you can say the pregnancy test is negative. Let's move on to the topic interpretation of the result. After putting sample into the S basin, after a minute you have to look over the rectangular result window, where if in front of the C area there is the positive line, and also in the front of the T area there is the line, there is the positive pregnancy test. And if there is line in front of the C and there is no line in front of the T, that means that the pregnancy test is negative. And if there is no line in front of the C and there is a line in front of the T, or there is the no line in front of the C and in front of the T, these both condition states that there is an error with the pregnancy test kit. You need to buy new one. Let's talk about false positive and false negative result. False positive is the case when the patient is not pregnant but the pregnancy test show the result of positive case. This is due to the pregnancy test kit error, or there may be other gynecological medical condition. Let's talk about the false negative. False negative is the case when the patient is pregnant but the pregnancy test is showing the negative result. Test is performed too early, then the test show the false negative result. That's all for today's video. Thank you for watching. Please do like, share and subscribe my channel.